In the days to weeks leading up to delivery, your body is actually doing a lot of work in preparation for labor, whether you know it or not. Your body is releasing hormones called prostaglandins that act on your cervix and actually ripen it. That's the medical term we use. So think of a peach that's not ripe, and then think of one that is. That's exactly like your cervix. It can be not ripe or it can be ripe. And when a cervix is ripe and you begin to have regular and intense contractions, then your body begins to respond by dilating. And dilating is the true definition of labor. You're dilating over a short period of time or from hour to hour. So you can have lots of contractions prior to actually going into labor as your body does prep work. If you're not actually dilating, you're not in labor. Now, this is the natural course of things. This is how a woman goes into labor spontaneously. Sometimes doctors offer it as an option to their patients to come in at 39 weeks and have an elective induction. Basically, this is just an induction for fun. It's convenient for parents, especially if they have other children because they can get a babysitter. And it's convenient for dads because they can get work off and you know that that's your ultimate due date. You don't have to go past that point if your doctor's offered to induce you at 39 weeks. You come into the hospital, we monitor your baby, we ask you questions, and then we start an IV and start infusing Pitocin or oxytocin, which is the same hormone that your brain is producing to give you contractions if you go into labor spontaneously. Your body doesn't perceive the difference. All it knows is when there's Pitocin, you begin contracting. So once you begin having contractions that are regular enough and intense enough, again, your cervix will start dilating and it will mimic what your body would have done naturally. Only we just started the process by giving you oxytocin because your brain hadn't started releasing it yet. Elective inductions are a fine idea as long as your doctors determine that your cervix is ripe and you're at least 39 weeks. So if you've been offered this option, it's totally fine to go for it if you want to. But if you don't want to go for it, you want to see if your body goes into labor spontaneously and there's no reason to medically induce you, then talk with your doctor and they can determine if it's okay for you to go a few more days or if additional testing is warranted. Do keep in mind that once you're 41 weeks, that's your ultimate due date. That's as far as you should go in pregnancy because the placenta stops feeding your baby as well as it should. And it has an expiration date. We just don't know where it is, but at some point it will not nourish your baby and they can be deprived of oxygen. So at 41 weeks, you do need to be done, but your doctor may feel like it's fine for you to wait until that point to see if you go into labor spontaneously. Now, many women want to know if they've been induced in the past, will they have to be induced every time in the future? Like, is it something that your body becomes dependent on or something? And this is a good question. But thankfully, the answer is no. Many women who have been induced in the past still go into labor spontaneously. It's not something your body becomes dependent on. It's not like your body got lazy and felt like it didn't have to do its job or anything. So there's always the possibility of you going into labor. If you have more specific questions, don't hesitate to ask your OB provider and they can give you the best information based on the specifics of your situation. But if you have any other questions for me in the future, feel free to ask them on our Facebook page at facebook.com/InnerMountainMoms and recommend us to your friends and family too.